Okay, perfect. Hey everyone, it's Rita Jada with the Live Longer podcast and Health Bootcamps, and we are talking about how to fix your leaky gut and how to get to greater health with Dr. Tom, who is, in my opinion, one of the smartest, most wise men I've spoken to in a long time about how we can be healthy. Dr. Tom, how do we fix our guts that are leaking?
The first thing we have to understand, there's lots of packets out there and products, and I've had so many doctors come up to me in seminars and say, I give glutamine for leaky gut.
Yes. Zinc carnosine, yes.
And they stand there like, oh, okay, well, that's good. That's helpful. But glutamine doesn't turn the genes on to heal the gut that vitamin D does. Or that curcumin does. That there is there is one product. If there's only one, there's one, and I'll talk about that. But what's most important to understand is that you can give products to heal the intestinal permeability, and the studies are pretty clear that these products can help, but the environment that the intestinal permeability is in, the tube itself, the inside of the tube, the microbiome, you have to change the microbiome, because if you have a disease, you've got a diseased microbiome. That disease developed over time because the microbiome that you have allowed that disease to develop over time. So in your case, you had colon cancer, and your microbiome allowed that to occur. There's no way you would have gotten to the health that you currently have unless you also addressed your microbiome.
Absolutely.
So that means what we talked about previously with the pre and the probiotics is a critical component to set the stage to heal intestinal permeability. And then, of course, we talked just a little bit about wheat, and that everyone gets tears in the cheesecloth when they eat wheat. So you have to get the wheat out of there. There are many other foods that may trigger intestinal permeability if you have a sensitivity to them. So you have to find out what those are. But the first and most important thing is the awareness that you're on the path to rebuild a healthier microbiome.
Okay.
That's really critical. You don't get that in 5 minutes or 10 minutes. I mean, that's
How
just
long does it take?
Say it again?
How long does it take to heal someone from a leaky gut or to heal a leaky gut?
Realistically, you can see changes on repeat testing within 2 months, 2 to 3 months. But if they don't continue the process, it'll come back.
Right.
It'll come back again. You can't go back to the old way of living. Remember, that's the whole thing about going upstream.
Right.
You have to figure out what fell in the river and make sure that you don't go down that river again.
Right.
Right? You just can't do that.
Yeah.
But in terms of the nutrients that help heal intestinal permeability, there are many. There are many good studies, and what I'm about to tell you is by no means exclusive. These are just the ones that have a whole lot of studies behind them, and they work in unison really well. So the first is vitamin D. See, if you think of intestinal permeability is like the Panama Canal, that the gates open into the lumen and food comes in, the gates close. The immune system checks out, what is this thing coming in here? Then the back gates open, the food goes further down, then those gates close. The immune system checks again, what is this thing? And it's an opening and closing of a number of gates for food and nutrients to come through the walls of the intestine into the bloodstream, through the cheesecloth and getting in there. Vitamin D controls the opening and closing of the gates. So that's why vitamin D is so important. And for taking vitamin D to help with intestinal permeability, you don't want to take the liquids that absorb under your tongue. Those are really good for systemic vitamin D, but you want the capsules or the tablets that go down in the gut, because that's where you want the vitamin D, is in the gut to help with the intestinal permeability.
I see.
Now, the liquid vitamin D, I recommend it a lot. It's called micellized because it's absorbed much better for systemic health, and every tissue in your body needs vitamin D. So in general, that's a more comprehensive form to take. But for healing the gut, You want the capsules or the tablets to get down there. Vitamin D. The next is the active ingredient in the spice turmeric
Ah.
is called curcumin.
Mhm.
And curcumin is the most potent natural anti-inflammatory that I've ever seen. There are hundreds and hundreds of studies on it, and it turns on genes that vitamin D does not. So curcumin. The next is fish oils, the good fats from fish, EPA, DHA. They are anti-inflammatory. They calm down the fire in the gut, and they stimulate the immune system to heal the intestinal permeability. The next is zinc carnosine.
Okay.
Zinc carnosine, there are 18 different types of zinc. Zinc carnosine is the type that has great benefits for your gastrointestinal tract
Mhm.
to help heal damaged gastrointestinal tracts. The next and the biggest kahuna is colostrum.
Oh.
And colostrum, is the first 3 days of mother's breast milk is not milk, it's colostrum.
Mhm.
And colostrum is the one that turns on all the genes in the gut that says close intestinal permeability, build the receptors for the good bacteria so that all that good bacteria can lock in on the lining, inside lining of the gut, and then colonize and build nice, strong families of good bacteria. Colostrum does all of that.
Ah.
And there's one type of colostrum that is head and shoulders the best that I've ever found. Um, my friend, Dr. Andrew Keach, was born and raised on a dairy farm in New Zealand, and he learned
Oh.
really quick, if you don't feed these calves colostrum, they die. Within a week, they die. You can't give them milk.
Oh.
And then he learned that humans that were sick, if they took colostrum, they got better.
Mhm.
So he decided he was going to dedicate his life to making the best colostrum in the world.
Wow.
So he went to Oxford and got a PhD in mechanical and chemical engineering. And I said, Andrew, I get it. Oxford, PhD, way to go, man. High five, way to go. But mechanical engineering,
Yeah.
what? What? And he said, well, Tom, I knew I was going to make the best colostrum in the world and no one knows how to do it. So I was going to have to learn how to build the equipment to do it.
Ah.
So he spent 8 years to
Mm.
do this.
Wow.
His colostrum is so good. Three governments in Africa, 3 countries in Africa, license his colostrum as the first treatment of choice that they pay for when somebody's diagnosed with HIV.
Oh, wow.
That's the same colostrum that's on my website. It's called GS Immune Restore, and it restores your immune system. So if there's only one thing you're going to take to heal the gut,
Right.
along with the pre and the probiotics, and stop the foods that are throwing gasoline on the fire, it's that colostrum. There's nothing like it on the planet.
Interesting you say that because I took the Silverin Labs colostrum for about a year
Yeah.
and I wasn't aware that there was a better formula. So I'm definitely going to check that out. And it's not something I've taken in a while. So I think it's time for me to kind of do a maintenance dosage of it. And you
Uh,
have to take that on an empty stomach, am I right?
no, you don't have to. Nope, not at all. My wife makes a smoothie out of it. She puts it in our smoothie drink with our vegetables and stuff. So it's great for that. She also does it sometimes plain, just with some water and a little hand mixer, and she puts some applesauce. Oh, that's the other thing I almost forgot.
Yeah.
Uh, to heal the gut.
Yes.
In England, this is from my friends, Doctors Michael Ash and Anthony Haynes in London. They call it stewed apples.
Hmm.
I call it applesauce. Right?
Okay.
So you take some apples. I take 4 or 5 apples, organic. Wash them off, but leave the skins on. Dice them up. Throw the seeds away, and you dice them up and throw them in a pot. Add water about a third the height of the apples.
Okay.
Throw some cinnamon in. Bring it to a boil. Let it boil in about 5 minutes, 6 minutes, something like that. You look in there, and when you see a shine on the skin, when it's starting to shine, turn it off, you're done.
Huh.
The shine, you're releasing the pectin from
Okay.
the apples.
Okay.
Now, pectin, when you eat pectin, it increases a really good guy in your gut called intestinal alkaline phosphatase, IAP. And intestinal alkaline phosphatase is a really good guy for you. because it prevents the bad bacteria from getting into your gut. It stimulates the healing genes to repair intestinal permeability. It feeds the good bacteria. So my patients have 2 tablespoons a day, and if you're a 200-pound person, you have 4 tablespoons a day. You know, it's not specific, the amount, but you don't need to eat a big bowl. But every day, you just have a couple spoonsful of applesauce.
Yeah.
And it's another little piece of the puzzle that you're turning the genes on to heal, reduce inflammation, and rebuild a healthier microbiome.
Love it. Such simple, easy to do things, which our grandparents used to do, right? If you go
That's
back
right.
to our ancestors, applesauce, apple pie, apple stewed, that
An
was
apple a day,
an
an apple a
apple
day keeps the
a day.
doctor away.
That's
This is why. Because it heals intestinal permeability. It increases intestinal alkaline phosphatase and heals intestinal permeability. That's the mechanism.
wow. Now we have the answer to why an apple a day. Makes a
That's
lot of
right.
sense.
That's right.
So in addition to healing the leaky gut, autoimmune has a lot more components to it. What else do we need to be on the lookout for? What else can we do?
The most important thing, in this short time that we have together, if you give me 10 hours, we do a whole
Yes,
course.
I know. Well, that's the boot camp we're going to do, right?
Yeah, it sounds great. Yeah, yeah. But the most important thing that you can do is embrace the understanding. It's going to take you 6 months to
Mm-hmm.
learn at 1 hour a week, just 1 hour a week, or 1 hour a day, whatever you can allocate, but just 1 hour to go back upstream
Yeah.
and look at all of the different things that are throwing gasoline on the fire in your life. We talked about air. We
Yes.
talked about plastics. We
Mm-hmm.
talked about, do you
Water.
know anyone whose life was saved by sleeping under flame retardant bedding? But we breathe that stuff in every night. It outgasses every night, and you're breathing that. So you can't tell because
It's
you can't smell it.
ridiculous.
But or like when you're pumping gas, sometimes you're standing there and you can smell the gas.
Yes.
That's benzene. Benzene is a neurotoxin to your brain. And we just stand there, we're smelling the gas, while it's going. So what do? Well, you're downwind. Walk around to the other side of the hose, and now you're upwind, and you don't smell it anymore.
Exactly.
But it's going to take you months to start thinking like that, to start,
Right.
wait a minute, what am I smelling?
Right.
Oh, it's going to take months to train yourself to
Yes.
think differently, how to be kind to yourself and take care of this body. That's the most important thing. If you can embrace the idea,
Mm-hmm.
base hits win the ball game. I want to learn new base hits every week, just a couple of base hits. In
Yes.
6 months to a year, you've got this down.
Yes.
You've got it down.
I love how you say, it's reframing the context. And
Yes,
listening to you, I'm thinking, you're almost saying, get on the defensive, defend yourself
that's
because you're
exactly
under
right.
attack.
You are under attack. You're exactly right. I've never thought of it that way, but we are.
Neither. We are, right? I didn't think of it until listening to you. I'm saying, wait a minute, we're under attack. From the
Yeah.
water we drink, to the air we breathe, to the things we watch, by the way. We haven't even talked about that yet. The emotional upheaval that we go through when we watch stuff that's being displayed on television, to the clothes we put on, to the makeup we wear, to the food we eat, to the drinks. All of it is actually attacking us.
That's right. That's exactly right. Let me give you one more example, if I may. One
Yes.
more. The most common autoimmune disease is thyroid dysfunction
Mm-hmm.
and Hashimoto's, and it's 9 times more common in women than men and all of that. Mrs. Patient, when you're on the elevator of a hotel, when the elevator doors open, can you tell the swimming pool's on that floor right away?
Yes.
And so many people say, oh, yes, yes.
Oh, yeah.
You're sensitive to chlorine. You're
Yeah.
smelling the chlorine. Now, why is that important? Because there are 3 chemicals. The way our hormones work, they're traveling in the bloodstream. Hormones are in the bloodstream,
Mm-hmm.
and they go by a cell, and there's a receptor site on the cell facing out into the bloodstream. The receptor site is like a catcher's mitt, and the pitcher throws the ball to the catcher.
Mm-hmm.
So there are receptor sites for every hormone. So estrogen goes into an estrogen receptor site. It won't go into a thyroid receptor site.
Mm-hmm.
Testosterone goes into a testosterone receptor site. It won't go into an estrogen receptor site. So
Mm-hmm.
all the hormones have receptors
Mm-hmm.
sitting on the outside of the cell facing the bloodstream. There's only two substances for which there are receptor sites on every cell of your body. There's only two substances, as far as I know. There's only two. One is vitamin D. That's how important vitamin D is to every cell of your body. And we'll have a session on vitamin D in the future. Uh, the other is thyroid hormone. Every cell in your body needs thyroid hormone. Why? Because thyroid hormone is the thermostat on the wall of every cell of your body, determining how hot that cell works. That's called your metabolism.
Wow.
And just like in your house, you turn the temperature down at night, while you're sleeping to save fuel, and then it automatically turns back up in the morning before everybody gets up. That's your thyroid hormone. So people that have thyroid imbalances, they've got cold hands and feet. They sometimes wear socks to bed. They feel sluggish. They're chilled often. They can't lose weight even if they don't eat for 2 or 3 days. They can't lose weight. And those are thyroid type symptoms. There are many, many symptoms of thyroid, but it's because the thermostat's turned down. Now, there are 3 chemicals that sit in thyroid receptor sites. They're attracted to and they sit in thyroid receptor sites, and they don't break down and go away. They just sit there. And if you've got these chemicals sitting in the thyroid receptor site, when thyroid hormone comes by, it's like the pitcher throws a fastball to the catcher, but he's got 3 baseballs in his glove. So the fastball just bounces back out. These are people that have blood tests for thyroid hormone and it's normal, but they've got all thyroid symptoms.
Me.
Exactly. It's because the thyroid hormone is not getting in the cell. It's not getting the cell because the cells are all blocked up. Can you smell chlorine? Oh, yeah, I smell chlorine. Well, that's why. It's because those 3 chemicals are chlorine, fluoride, and bromine. Bromines in breads. Chlorine, fluoride, and bromine. So people that have any of those types of symptoms, they need chlorine shower filters, because that's where you get more chlorine than anywhere else, is you inhale it, the steam in the shower.
20 minutes a day, maybe sometimes twice a day.
Yeah, yeah. So that's an example of the environment. And when you learn this, and then you go on and you go to Whole Foods, or you go to Consumer Reports and look at the reports on chlorine shower filters. And they'll tell you which ones look to be the best and which ones, how long they last. And you replace the filter. So they're so easy to put on. You unscrew the shower head, you put the whole filter on there, then you screw the shower head on the other side of it. It's really easy. And then every 6 months, I just change the filter inside that unit. It's easy to do. But that's a base hit. And when you do that, you'll notice within a couple of weeks, your hair has a nice shine to it. Your skin feels softer because you're not being exposed to all that chlorine.
That's on my to-do list now for next week. That makes a lot of sense. The other 2 chemicals, fluoride, so that's the toothpaste, right? The cavities, fluoride. We don't need fluoride in our toothpaste, do we, Dr. Tom?
We do not. We do not. If you read the history of where fluoride came from, it was a garbage product from the chemical industry, and someone had the bright idea, let's see if we can put it in the toothpaste, because I think it's an antibacterial, and so let's try it. Let's see if we can put it in the toothpaste. And in the water. They used to put fluoride in the water also. And it's just, there is so much evidence how dangerous it is for us to have fluoride and chlorine. I'm not saying chlorine's not necessary. Chlorine is necessary by all means, but then before the water gets to you and your family, you filter it out. So if you can afford it, you get a whole house water filtration system. That means so all the sinks when you're brushing your teeth, in the kitchen, the water you're drinking, and in the shower, it's all chlorine free.
Yes. No, that makes a shower filter. Dr. Tom, thank you.
Thank you so much.